Over the past 4 years, the Oversight and Government Reform Committee has conducted vigorous oversight of the implementation of the Affordable Care Act, often called Obamacare, including the design and launch of healthcare.gov. Today, the committee focuses on the interconnected issues of security of the website, accountability within the administration, and most of all, transparency to the American people. The Government Accountability Office released a report this week on security of healthcare.gov. The GAO found the administration failed to take appropriate and sufficient steps to protect healthcare.gov and associated systems against security and privacy risks. More importantly, the GAO report strongly asserts that security testing is not complete and security weaknesses continue to plague the website. One of the principal authors of the GAO report will testify before us today. The committee has released a report detailing several breakdowns in both accountability within the administration and transparency to the American people during the design and implementation of healthcare.gov. It is important to understand that with private sector high-profile losses of information due to hackers, there are huge repercussions to those companies, and the government often comes in and further victimizes the companies who have in fact been victimized by hackers. And yet, when the government fails to protect involuntarily taken personally identifiable information, there is nobody but people on this dais to try to hold government accountable. Documents obtained by this committee show factions developed within the agency in charge of implementing Obamacare, the Center for Medicare and Medicaid Services, or CMS. These factions fought over several issues, including over website security. CMS often fought to keep information from their colleagues within the larger Department of Health and Human Services, and additionally, the administration endeavored to keep the truth and the true nature of the website's problems out of the public eye. Following the collapse of healthcare.gov, administration officials refused to admit to the public that the website was not on track to launch without significant functionality problems and substantial security risks. Last month, CMS denied the Associated Press access to security documents requested under the Freedom of Information Act. Even more recently, CMS refused to provide the Government Accountability Office documents related to the 13 incidents that we are going to hear about in vague detail here today. I want to make something very clear. Refusal to cooperate with the GAO, a nonpartisan government-created entity, refusal to allow access by the whistleblowers under Freedom of Information Act, and refusal to cooperate with even the Inspectors General, something we saw here just a few days ago, with 47 Inspector Generals out of 73 complaining with the lack of access even within the executive branch. This is not the most transparent administration in history, and certainly the transparency we see here today was only done under subpoena. We will probably hear today that CMS has offered to brief GAO on these 13 incidents. It is not acceptable after the public scrutiny reveals that they exist and they have been denied on the eve of a hearing and only after an audit is completed to then say, we would be glad to brief you. That is unacceptable and, quite frankly, one of the most disingenuous things I have ever seen. There were 5 months during the audit to comply with a reasonable request by the General Accountability Office, and it was not done. Questions of security can no longer be easily dismissed by the administration. In late July, healthcare.gov suffered a malicious attack from a hacker, and it took nearly 2 months for CMS to identify the intrusion. CMS Administrator Marilyn Tavenner, who is with us today, will testify, and we will discuss that in addition to the GAO report. I'm sure we will hear that there was no loss of data, that this was not the main site, and so on. That doesn't change the fact that security risk exists whenever you fail to secure not just the main site, but back doors. Too often, back doors have been what we've discovered. In the case of another investigation of this committee, we discovered that the back doors were something as simple, in one case, as a stolen laptop on which those who stole it later added peer-to-peer software, which then made information on that database available to the public potentially. The Federal Trade Commission opened an investigation, and a plaintiff's trial lawyer sued and won money on behalf of people whose information was never actually released, but in fact, both the government and plaintiffs' bars thoroughly enjoyed going after a nonprofit AIDS clinic. I cannot and will not allow our government to put itself at a different standard of accountability. Last month, the Center for Medicare and Medicaid Services informed the committee that once again there were lost emails responsive to the committee's subpoena and documents relative to healthcare.gov. This is not an uncommon pattern. This is a pattern of predictability. This administration has not complied with nor caused their key executives, including political appointees, to comply with the Federal Records Act. Administrator Tavenner admitted to deleting her own emails during the time period of Obamacare implementation. Madam, your actions hinder Congress's investigation and also prevent the public from accessing information under the Freedom of Information Act. It appears as though this administration holds itself to a different level of compliance with historic Federal documents than the last administration or any administration since the passage. We are also today joined by the Department of Homeland Security's U.S. Computer Emergency Readiness Team, or CERT. The committee has concerns about the team's transparency regarding hack reported earlier this month. The administration has already spent $1 billion on a website that is still not fully operational and fully not secure. The same government officials responsible for the lack of transparency and accountability a year ago remain in the position of authority. Questions of security, accountability, and transparency go beyond whether or not you support the President's health care law. Many of these issues are not limited to health care and mirror the transparency and accountability concerns raised again by 47 out of 73 Inspector Generals in an unprecedented letter to this and other committees of Congress in August. Minutes before HHS announced publicly on September 4th that healthcare.gov had experienced a malicious attack in July of this year, an HHS official contacted my office to give them limited details of the successful hack. During the brief call, HHS gave my staff the name and phone number of a contact at the Department of Homeland Security and suggested my staff contact DHS for more information about the hack itself and the government's response to the hack. My staff reached out to HHS's suggested contact at DHS on Monday of last week, followed up on Tuesday, and were told that DHS was running, and parentheses the request, back with HHS to see if we can all jointly get on the phone, seeing if tomorrow will work. However, my staff followed up on Wednesday and Friday, and then on Monday and Tuesday with no response from DHS. I would like to note that despite a week of persistent emails from my staff, DHS was unable to make time to brief our committee even by phone. However, 2 days ago, the minority staff notified me that they were asking for our witness today, DHS, to appear as a witness at today's hearing. I accepted it, even though clearly this is a witness from an organization that has refused to answer questions or cooperate with the investigation. When the minority staff reached out to ask if DHS would appear as a witness, DHS was able to produce a witness prepared apparently in detail to provide testimony before this hearing today. However, DHS has still not arranged to properly brief our staff or to answer questions that we will be asking here today. I would like to introduce into the record at this time the correspondence between the staff and DHS as an example of what appears to be a very different treatment from this administration to a request from the majority staff versus a request from the minority staff. Without objection, it will be placed in the record. Let's cut to the chase. I have with me 3 witnesses. 2 very clearly are not part of transparency in government. I have no doubt that your organizations have worked diligently with the minority to try to make this hearing good for you. It is not our job to try to make this hearing bad for you, but the American people deserve the truth, not a cozy relationship between the people of your President's party in covering up the ongoing failure to secure a website that cost over $1 billion. And with that, I am pleased to recognize the Ranking Member for his opening statement.